Good evening, everyone. This is Dr. Schilling with this week's Wednesday Wellness Minutes, and we're super excited to talk with you this evening. We're going to talk about what's called tic douloureux. I don't even know if I pronounced that properly. Trigeminal neuralgia is the medical term that's more commonly known. And if you know about anything about the trigeminal nerve, tri meaning three, there are three branches, and I'll just give you an example. These are the three general branches. Okay, so you have down in the jaw, across the cheek, and then into the forehead. And this nerve we're going to learn a lot about. It gives people a lot of problems. It usually causes problems when you get some type of what it's called post-herpetic neuralgia, which is a fancy word for the after effects of a viral reaction in your face. And so what we want to talk about is understanding that this nerve, everybody has it in their head, and it's really important because it has part sensory and part motor, which we'll talk about. It can cause facial paralysis. Like some people experience Bell's palsy and things like that. It can affect the cranial nerve 7, but it can also affect cranial nerve 5. So the sensory branches are basically from here, go straight down the jaw, so you can experience jaw pain. And this nerve is commonly associated with compression because it passes through here, and there's right in front of your ear. There's the bony cheek part. Right above that, there's a little. You can't feel it, but there's a ball in there. If you press hard enough, that's literally the nerve bundle of the trigeminal nerve, which then branches out into the three areas. So if you get your temporalis muscle here super tight, it can potentially cause irritation in that area. So if you grind your teeth, clench your teeth a lot, it can cause a big problem with this. So remember, the three branches are here as far as sensory. There's a strip across like your nose and your upper lip, and then it starts at the middle of the head and comes down to pretty much the tip of the nose. So that's kind of the sensory area, and then that's going to affect the different muscles of the face and things like that. But there's also blood vessels that go along with that. And so when you think about this nerve, it can cause you a lot of problems and a lot of pain if it becomes a problem. So it can cause severe shooting or throbbing. Some people talk about it as like electric shocks. And we'll talk about in a little bit why it might be affecting that area, because typically what's associated with this is, as I mentioned before, a virus, and that is a result of stress. Okay, if there were no stress, you would have no problems. Let's put it that way. These pains can happen spontaneously. They can come and go. They can last for minutes, seconds, minutes, days. Some people are just gripped with pain by them. These can really cripple someone's life, and it'll affect how you think, because chronic pain suppresses your frontal lobe. I don't know if you can see in this picture back here, but frontal lobe is like really right behind your forehead. It's the seat of all intelligence for the human species. It's our creative center. And if you're in chronic pain and anywhere in your body, not just your trigeminal nerve, it can cause a limiting function in your creative centers in your brain. So aching, numbness, spasms. You can have part of your face like literally go into spasm, and contracture, like your eye could get twitching shut and things like that. You can get pain in your teeth, in your jaw, could be in the cheekbones, even the forehead, as we mentioned before. Rarely is it both sides of the face. Typically it happens on one side. We don't need to go too far into neurological conflicts, but when there's a stress, like let's say the motor function on this side is controlled by this side of your brain. And so if you had this side of your brain affected, and it showed up here, it might be a territorial conflict with a spouse or a partner or some type of work or things like that. So there are specific brain functions and how they affect and why it happens on one side. So takeaway from this is nothing happens by chance in your brain or in your body. If there's ever a symptom, it's caused by something and there is a reason behind it. And we can help you find that if you're so interested. But this can come frequently or infrequently. It can come and last for a while and go away and not come back for many years, and then all of a sudden, boom, it comes up again. So let's talk about those conflicts for a second. It's important to understand that this can be related to a separation conflict. So when you think about the face specifically, because of course the trigeminal nerve is a part of the face or underneath the skin of the face, it's a separation conflict. So it can be literally a loss of contact, like literally or proverbially, which is like hypothetically. It can come from feeling like you've been slapped in the face physically or, again, hypothetically speaking. Some people, when they lose contact with someone, right, especially people that are in their older years, that we call the twilight of life, right, and people are now nearing the end, they can get these trigeminal neuralgias because they're losing people in their lives. They're separation conflicts. They've lost a loved one, a spouse, a partner, something like that. Oftentimes when we have pain in the bone, it's considered a self-devaluation conflict, and there's a lot of different reasons behind self-devaluation conflicts, but it's literally seeing yourself as less is what a self-devaluation conflict is, simply put. So when it affects that type of nerve, that's what it's going to be related to. If you feel bone pain, like deep, gnawing bone pain, it could be in the cheek, in the forehead, or in the jaw. And this, again, it can be very debilitating for people. If you've ever had chickenpox, or they call it shingles after you've had chickenpox, so you have a recurrence of it, even though the theory goes you should have immunity for the rest of your life once you've had chickenpox. No, you should never get it again, but somehow it comes back as shingles, which is interesting. But what can happen is you get these spots, these little blisters on your skin, and it usually traces the path of the nerve. You might get it on all three branches. If you have what's called postherpetic neuralgia, or after the herpes zoster, it can come on your forehead. People can get it in their ribs, but in case of the trigeminal nerve, it's the forehead, cheek, or the face, on the lower jaw. It can come from any part of that. There are other areas. Typically what they say is once the blisters either pus or expose themselves and weep, then they can get bacteria in there. It can become cystic and things like that, and scarring and stuff like that. But it's oftentimes associated or accompanied by stinging, which is never fun, right? Nobody likes to have a stinging, gnawing pain in their face. It's just not cool. The theory is when a virus is involved that it migrates down, like the dorsal root of the nerve, and it hides in there dormant, and then somehow it just becomes opportunistic and comes out of hiding. But again, if you weren't stressed, they would not come out of hiding. So whether it's the herpes zoster, herpes simplex, or maybe HHV6, human herpes virus number 6, which is a common one, it can be very specific. There's always a part of the brain that the virus is related to. The pigment of the skin and or just the skin, dermis and things like that is always related to either the cerebral cortex or the cerebellum. Cerebellum we'll talk about in a minute, but there's different areas. And so if you have an expression something on your body, it's going to be coming from somewhere in your brain. It just doesn't happen down here by random. If you've ever seen the cortical homunculus, at the risk of not being able to see this, it's worth showing. If you type in cortical homunculus in the computer, you can see hopefully something like this. It's how the body's mapped on the brain, okay? And you'll see a funny little dude. He's got a gigantic head, big hands and big feet, and a tiny little body. So cortical homunculus. That's going to help you understand how many nerve endings are devoted to the different parts of the brain, so how much your brain devotes to your parts of your body, but it also shows you how significant it is and where your parts of your body are mapped on your brain. That helps you understand like why it shows up on your body and how you can trace it back to the brain, and then you can figure out what the conflict is and things like that. That's really helpful. Conventional medicine, as I mentioned before, it says that once you get chickenpox, you should have lifelong immunity. But somehow you get these shingles and stuff like that, and it can come back as that kind of thing, which is not cool because anyone who's ever had shingles or seen someone with shingles, it just looks painful. It looks weepy, and it's red and angry, and it's just not cool. So let's talk about some of the issues with the face, right? There's a lot of different stressors you could have in your life that are related to your face. Emotional numbness, loss of face, like you get embarrassed by something, you're missing contact with someone, like humiliation, embarrassment, feeling shy. If you have an extreme shyness, it can come out there. If you're dealing with someone in your life that's emotionally volatile, that can affect you in your face and or theirs. And it also could be someone in your life is emotionally indifferent. All these different conflicts can affect you. If it were on the head per se, that would be inability to connect with someone and or like inability to like literally reach the top per se. Inability to reach the top, that's part of the head. But skin in general, if something comes out of this like a wound or an acne or something like that, that's like feeling verbally abused, feeling insulted, shamed, verbal abuse, something like that. That can all affect your skin. So herpes simplex, there are specific stressors. Simplex, people think of either cold sores, cold on the outside, cold sores, and or genital herpes, and that's herpes simplex. But it can manifest anywhere. You can get postherpetic neuralgia related to herpes simplex. anywhere on your body. So it could be on the trigeminal nerve, or it could be on somewhere else in your body. But there are specific stresses related to that. Herpes simplex is hard to be honest, feeling like you're missing out, not getting life's rewards. You might be having a hard time taking action. There's a lot of different things. Wanting to hide, not wanting to deal with things. That can be affecting that. Then herpes zoster, unrealistic fears, worry in excess, expectations not being met. There's a bunch of different stresses related to the chickenpox virus, herpes zoster. Herpes varicella zoster is what it's called, fancy words for it. It can also be related to communication issues and things like that. Okay, so just remember, this type of nerve is really related to not only sensory function, where it's like pain in the jaw, teeth, skin, and in the eyes and on the forehead, on the top of the head, but it's also the function, like how you move your face and things like that. It's not as involved in your face as much as cranial nerve 7 is. However, it is pretty well involved in that. But getting good sleep, right? Every minute before midnight's worth 3 minutes after. So get to bed early. I think maybe it was Benjamin Franklin said, maybe not. Early to bed, early to rise makes a man or woman healthy, wealthy, and wise. It's a good motto. So the earlier you get to bed, the earlier you get up, the more effective you're going to be in your life. Proper sleep, proper exercise. Exercise boosts the immune system, keeps your brain strong. It de-stresses you, which leads us to our next point, which is de-stress. Find time for meditation or quiet prayer. Shut things down, get away from technology, things like that. De-stressing from people, toxic relationships. Those are challenging if they're in work relationships and things like that. But if they're family relationships, it can be even tougher. Hard to buffer yourself from that. We have tools for that, and we can help guide you through that process. But taking some supplements, depending on whether you need help boosting your immune system for herpes zoster, herpes simplex, HHV6, or whatever viral stress it might be that might be manifesting in terms of the outward expression, not just the pain on the inside, because it doesn't have to show up on the skin for it to be a problem on the inside. You can still get help with the conflict and or resolution of that immune stress. It's called the hanging conflict there. But get help from experts like us who can help de-stress you and help your brain take off the edge, if you will. So I liken it to having sticks of dynamite in your nervous system that there are fuses off of, and certain people light those fuses. Well, what we do with QNRT is take the fuse off of that, so they can't light that fuse and you can't be triggered by them or the situation, whatever stress it might be. So that's what we're specializing in, and that can help you just to have a much greater degree of quality of life and enjoy it more. So this is kind of a basic breakdown of the functions, the movement and or sensory of your face, what is affecting it, that you're not really going to read about in a textbook. But we'd really like to know if this has been beneficial for you. So let us know if you found this beneficial, thumbs up, and or I think we've talked about doing the angry face if you didn't like it. So we don't have a thumbs down yet. I'm sure there are other gestures we could use with emojis that would tell us you were unhappy with it, but just use the angry face. We like that feedback because then we can grow from that and make it more pertinent and helpful for you. Let us know what you'd like us to discuss on these Wednesday Wellness Minutes, because ultimately we're doing this for you because we want to be a service for you rather than just talking about what we do on a daily basis. It's really helping you understand how you can benefit and help yourself. Share it with your friends and family, provided you believe this is helpful. Then you can empower them to understand their issues. And if they have a question, they can send a text in, send an email in, do a private message here, something like that. We can give them some information, general of course, because we can't specifically talk about their condition, but we can give some ideas on how they might help themselves, empower them to take action on their own. We're going to be starting regenerative medicine, regenerative cellular therapy next month in November. We're excited about that. Taiwo, our nurse practitioner, he's here on Fridays. So we're going to be starting to do our intra-articular injections with the PRP and what are called exosomes and all the other healing tissues that are going to help benefit you and get your life back and get you help regenerating instead of continuing the degeneration. Because we're all losing the race against inflammation, depending on how many activities you take on a daily basis. But this can really boost your healing ability and help you regenerate tissues rather than continuing on the downward spiral of degeneration. Next week we're going to be talking about breast cancer. I believe October is Breast Cancer Awareness Month. It's a heavily misunderstood concept. A lot of misinformation out there. Basically, people think if you get the big C, the big cancer, it's a death sentence. People talk about different hormonal triggers and things like that. We'll talk about all that, and stress, of course, because if you didn't have stress, you would have no problems. Okay, so pretty simple. At any rate, we appreciate you joining us this evening, and we look forward to seeing you next week for the Wednesday Wellness Minute. Take care, everybody.